And here we go. Welcome everybody to The Big Idea. I'm Dr. Jeffrey Hanna. Today we are going to be talking about cerebrospinal fluid flow and why that might be so much more important when people have pressure at the base of the head. We're going to be looking at a couple of MRIs for people who have been dealing with headaches, migraines, constant dizziness, including where the radiologist basically said everything is looking normal. I'm going to start out with a brand new piece of research that's saying that it's not necessarily the size of a lesion, but how it's affecting the circulation that makes the biggest difference. Let's jump into it. Okay, now do forgive me, I'm playing around with a little bit of green screen. I'm not a technical guy when it comes to this. We're learning this as we go along here. So bear with me, but here's what I've got for you. Research. Correlation of anterior cerebrospinal fluid space in the cervical spine with Chicago Chiari Outcome Scale score in adult females. Wow, that is a mouthful. What is this? What this was a bunch of researchers who were looking at people who were diagnosed with Chiari malformation. I've done a number of videos about this particular condition. The short of it is it's where the base of the brain stem or the cerebellum starts to actually descend into the spinal canal itself. Imagine, if you would, that what you're doing is you're trying to shove your foot into a shoe that is 1/2 size too small for you. You can probably do it, but it's going to create more pressure, more tightness, and people who have Chiari malformation, they're more likely to experience dizziness, headaches, migraines, blurry vision, chronic pain, all kinds of different things like that. So what these researchers did was they wanted to see, was there a specific measure that would be the best way to assess the severity if people ever had this kind of condition going on the inside of their skull. So what they had originally hypothesized was that it was the shape of the skull itself that was going to make the biggest difference, because we all have different genetics, different anatomy on both the outside and the inside. Some people can get away with just about anything, and other people, through no fault of their own, are more likely, they have a lower threshold or margin of error where they're going to start to experience symptoms. What the researchers thought then was that there are certain risk factors that if we can make these various measurements, that we can find out what is going to be the biggest risk factor for people who have a Chiari malformation. So what they did was they did MRIs on 115 people diagnosed with Chiari malformation. And they did a number of different measurements, including McRae line, which is the size of the Chiari malformation, the length of the base of the skull, the angle or the orientation where the skull meets the spine. They were looking at the amount of space that was available for fluid to flow inside of the spinal canal, and also how basically the cerebellum was sitting relative inside of the skull itself. And they did this for kids, they did this for men, and they also did this for women. What they found first was that in the kids, none of the skull measurements made any difference whatsoever. But what they did find, at least in adults, is that the amount of space available for the fluid to flow, that is what made the biggest difference, particularly when they were looking at the amount of space in the front of the spine, particularly as it relates to women, more than men and more than children. So what does that mean? It means that it's not necessarily the size of an obstruction or even the shape of your skull that makes the biggest difference. It is the ability of fluid to flow the way that it is supposed to. Now you might be wondering then, well, why would this be a bigger risk factor for women? Okay, let's start with the kids actually. As children, we have more functional space because our body has not fully grown yet. So even if we have very large Chiari malformations or obstructions or other kinds of issues, because we haven't yet grown into full size, our body or neurology is essentially still growing into the shape. But when we become adults, then we don't have near as much functional space. And as a general rule of thumb, guys are going to be bigger than women. Their bone structure is going to be bigger. The diameter of their nerve canal is going to be bigger. In women, it's going to be smaller. but the size of our brain, the size of our spinal cord is usually about the same. So in guys, if I was going to use my hand like this and say, okay, well, here's the size of the spinal canal and then here's the size of the spinal cord right there, you're going to have about this much extra bit of wiggle room. In women, because women are typically more petite, there's not going to be as much space. It is more likely then that if a woman was going to be having some kind of an issue with the base of the skull, with the base of the neck, things like that, that it's going to show up in her. And this might be one of the reasons why women as a general rule are more susceptible to headaches, to migraines, to dizziness, to any number of different neuromuscular conditions. At least that's what the hypothesis is. So what I'm going to get into now, it's actually not a female, this is a male. This was an MRI that was sent to me to review where we see this exact kind of disruption going on. Let's have a look at that. Okay, I'm going to start out with this picture here. This is an MRI that was sent to me of a 20-year-old young man who's been experiencing chronic neck pain, chronic headaches, chronic dizziness, anxiety, a plethora of symptoms. He's been around the block trying to find out what's going on. These were the MRIs that he had taken. What they discovered was I'll show this on a slice in just a sec, that he has a small swelling inside of his spinal cord lower down in the neck. But from a brain standpoint, they said that, quote, everything looked normal. I was asked then to have a look to see if there were any signs of functional disrelationships that could possibly explain what he had going on. So here's a couple of things that I can see firstly on this particular slice right here. Number one is when I'm looking at the white stuff that you see around on his brain, and this is as if we're looking front on at this person. So left side's over here, right side is over here. I'm looking at this and I'm thinking, there's too much fluid that's on the inside of that skull right there. That's not going to be a good thing, because if you've got the accumulation of too much fluid inside of the brain, even if it's not causing abnormal pressure such as a hydrocephalus or something like that, you know what, people are still going to be able to feel all of this stuff. And this is suggesting to me that he has a drainage issue. Something is not allowing fluid to properly exit the skull, coming back to the heart, and it's accumulating inside of the head. This is very common for people where they say, I feel better when I lie down and I feel much worse when I'm sitting or standing up. So we can see he's got a little bit too much fluid here. I also point out that if we're looking, you might be able to make out this little bow tie shape right here. That's the top vertebra in his neck, and you might see this little peggedy thing that's kind of in the middle. That's the C2 vertebra. You might be able to also notice this kind of shade of gray here, and then this little black slip right here. What we're looking at are the ligaments that anchor the top two bones in the neck onto the base of the skull. And ligaments, when you're looking on an MRI, should be pure black. I'm talking black like this over here, like you see right there, not a shade of gray. Shades of gray implies that there is thinning, that there is tearing, that there is a torn ligament depending on the degree of the damage. I look at this MRI and I'm thinking this person's had a physical trauma at some point. The vertebrae in the top of his neck are not properly anchored onto the base of the skull. As a consequence, you can start having abnormal motion patterns. Abnormal motion patterns in the top of the neck, like I've talked about on other videos, whether it's too much movement or too little movement, that can absolutely start affecting circulation from the brain back down to the heart. So we're looking at this and I'm thinking, something's not right in that area. First and foremost, the radiologist said that this was completely normal. More appropriately, maybe they just weren't looking at it this particular right way. And it's not to throw anybody under the bus, because radiologists are trained to look for overt pathology, tumors, broken bones, gross dislocations, bleeding, infections, that kind of stuff. This doesn't fall in those categories. This is a functional disrelationship that requires a little bit more in depth, a little bit more training to be able to identify these things. So I can see that something's not quite right here. Let's have a look now from a side perspective in terms of what's going on with his fluid flow. Okay, so what we're looking at now, this is essentially the side of the neck. Again, I'm looking at the white space right here. This is fluid inside of the brain. It should be there, but that looks to be a little bit more than normal. I'm looking at his cerebellum and the brainstem right here. I don't see them descending out of the base of the cranial vault, so I'm not thinking Chiari malformation in this particular case. But check this out. If you're following his spinal cord down like this, you'll notice this white thing right through here. That's what's called a syrinx. The radiologist did catch this. A syrinx is oftentimes going to appear where you've got a fluid disruption inside of the cord itself, and it starts to balloon out like this. It can start causing a whole bunch of neurological symptoms. Now, in addition to that, when I'm looking at the overall curve of his neck, even though he was lying down when this picture was taken, a neck shouldn't be curved like this. The neck is supposed to have a lordotic or forward-facing curve like this. This is consistent with a whiplash injury, any kind of trauma where the head snaps back and forth like this. It doesn't have to be a car accident. It can be a sports injury. It can be a really nasty slip, a trip, a fall. You get the idea. The list goes on and on. So I look at this and I think, this guy's got some damage. Now, he doesn't have any pronounced disc damage, and he doesn't have any disruption of the ligaments either in the back of the neck or in the front or anything like that. So that part's pretty good. But what I do want to illustrate here is have a look at his spinal cord as it comes down like this, and how little space there is, that bright white, the fluid between the cord and between the back of the neck. The radiologist made a comment, and I think that it was absolutely on point. Some people have what's called a congenital stenosis. And what that means is it means that if this is the normal diameter of their spinal canal, through no fault of their own, it's just a little bit smaller. This guy has a slightly smaller spinal canal. It means that even in the absence of overt pathology, he has a much smaller margin of error in terms of things being able to move, because the spinal cord does not just sit inside of the canal. It actually oscillates up and down about 1 centimeter or 1/2 of an inch. And every single time that it goes up and down, there's going to be changes in circulation, fluid flow, but also potentially a little bit of friction if and when that cord ever abuts against either the front of the canal or the back. And in fact, what I'm seeing here, if you're looking down through the lower part of this MRI, you might be seeing these little weird vertical lines. That's not because there was a problem with the MRI. Weird little artifacts like that can sometimes show up on an MRI when there is turbulence or abnormal fluid flow. So even though we do see that there's at least a little bit of space along the front, this is going to suggest that things are not actually flowing the right way, that there's abnormal turbulence. And in fact, if you're looking at the amount of space along the back of the canal, you can see that it's even smaller. In fact, the cord is actually butting against the back part of the canal as you're starting to get down to the lower part of the neck right through here. Now, to their credit, the radiologist, his referring physician, had also referred him for flexion extension views in MRI. This is not terribly common, but he's got enough stuff going on that it was worth having a look at this. So have a look at this, because when he moves his head forward, there we go. And have a look what happened. Just by tucking his chin down and forward, look at that. That cord starts to actually come right up against the front of that neurocanal. I don't see where the cord is being indented, a sign of overt pathology, but remember that research that I just showed you. If you don't have enough functional space for fluid to flow, it doesn't matter what the size of a Chiari malformation or another obstruction is going to be. If you've got a fluid disruption because there's not enough space in either the front or the back, that is actually going to be correlating with worse symptomatology. So his neck's in flexion. You can see that right there. That is not going to be sufficient functional space at all. So head's back to neutral, but then they also did an extension. Look at this. When he brings his head backward, yes, it does open up the circulation space toward the front, but now look at this. the cord is coming right up against the back of the canal right through here. And you don't see the normal amount of fluid that should be going through that. And again, we're seeing some of that artifact like this, the little bit of abnormal fluid flow. And again, you can see all of the white in and around the brain. This is going to be associated with increased pressure, increased fluid accumulation inside of the brain. Now, this particular young man, he also had something really weird that I spotted looking at his MRIs. This is rare. I had to look this up. This only shows up in about half of 1% of the population, but it may explain, again, why he's more susceptible to some of these different symptoms. And one of the things that, even though rare, is worth looking at when people have some of these weird symptoms, the MRIs are quote unquote normal. I'll show you what I saw here. This is definitely not normal. Okie dokie. Now what we've got is we've got a cross section of this young man's MRI. So we're looking through slices cutting down through the neck like this. This is at the level that corresponds with the level of about C2 in the neck, C1, C2. Left side's over here, right side's over here, and his head is neutral. So you can see that we do have a good amount of functional space for that bright right cerebrospinal fluid, more in the front, less in the back. So there could be an issue with circulation there. And you may not be able to make this out abundantly clear. I'll do my best. You might see that there is this giant black hole right here on this side. That's normal, first and foremost. That's the internal jugular vein on this young man's right side of his neck. This is what we would expect it to look like. Now, if you were to come over onto the other side, and I'll point out that there are also these other little black holes right here. That is the internal carotid artery. Arteries are typically shaped like a circle. Veins are going to be more shaped oblong like an oval. If you're looking over here, you're like, oh, where is it? I don't see it. This is a common finding that we'll actually see on MRI that can be a sign of vertebral misalignment. If the bones in the neck have ever been injured and they lock forward, whether it's the C1, the C2, the C3, they can actually produce a mechanical irritation or compression of that internal jugular vein, and that can be the source of the blockage where blood is not able to come back from the brain. And that's what I initially thought was going on in this young man's case. But I got curious, and what I did was I started sliding down his neck a little bit farther. So here we go now to the level of about C3, C4. You can still see that internal jugular vein, but I had to admit that actually looks a little bit bigger than it normally does, and I still don't see it on the other side. So let's go down a little bit farther. Geez, that thing just keeps getting bigger and bigger, but I don't see anything on the other side. Now, this is also a really important cross-sectional slice. Let me go back just a little bit here. Okay, have a look at how much of that white space is around the cord at that particular level. But then I come down just a little bit farther in his neck. The cord is this dark gray thing right here. If I come down even a couple little slices, I mean, look at that. I repeat, the cord is not getting indented, but there is no functional space for that fluid to flow at all. Is it any wonder he's having the symptoms that he is? But getting back to what I'm talking about, this internal jugular vein, it's like, wow, that thing looks just absolutely huge. Let's go down even farther. That thing is still, it's giant, but it's like there is nothing on this other side, no matter how many times that I go down. So what's actually happening here? So I'm wrapping up with this particular slice again. This is the one that we started with. And let me draw your attention to this grayish structure that you see right here. This is, on the right side, the internal jugular vein. But have a look. It simply put isn't there on the other side. This is a congenital anomaly. Remember what I said, all of us are different on the outside and also on the inside. Not just in terms of bone structure, but also in terms of our vasculature, arteries and veins. This young man, I think he needs a follow-up with either an ultrasound to confirm if this is legit or what's called an MRV. So magnetic resonance venogram, where they're looking to see what is the course of the blood vessels in his neck. This is the equivalent, if you would, where a person may only be born with one kidney. They can still function, they're still healthy, but that one kidney has to work harder. This young man, I believe, only has one internal jugular vein. What that means is instead of having two drainage pathways, two primary drainage pathways from the brain, he only has one. Now, that would explain why it appeared so big on the one side and why it was absent on the other. But then I think that you can also appreciate that if you add that this young man has had a neck injury where we see evidence of ligament damage, where we see evidence of fluid disruptions, if he is having something that is affecting this particular drainage pathway, all of a sudden he goes from having one pathway to less than one. Not zero, because there's still fluid that's going through that, but if 100% of the fluid from the brain is not able to, or is normally coming out that one pathway, but he has a blockage, and let's say that only 90% of it can actually get out, that back 10% is going to start to accumulate and might be one of the factors in terms of why we're seeing some of this swelling on the brain and why he's experiencing some of the symptoms that he is. So that's what I've got for you in this particular video, talking about how, again, it's not solely the size of an obstruction, whether that's a disc damage, whether that's a Chiari malformation, or whether it's even a misalignment in the neck. But if you've got that something that is affecting the functional relationships and how much space there is for the fluid to flow, that might well be the most important thing for you to look at that helps you understand then what would be the appropriate treatment to find that health breakthrough that you're actually looking for. So the young man that I showed you, he still has a long road ahead of him to find what that breakthrough is. But I hope that this would at least point and give hope and ideas for other people who might be experiencing so many of these different symptoms looking for answers. So as always, thank you guys for watching this video. If you did enjoy it, please do click that like, subscribe button. Please also be sure to share this video. Friends, family members, clients, colleagues, if you think that they would benefit from watching this. If you want more information, you can check us out on our website, which is clearchirospokane.com, where we've got links to all kinds of blogs, other videos like this, talking about other issues, how the neck affects your overall health well-being. Thanks again for watching. This is Dr. Jeffrey Hanna at Clear Chiropractic. Get well, live well, stay well.